Hi, my name is Latoya, and this is my podcast, Let Your Hair Down, where we talk about everything. So be yourself at all times.
And our guest today is Barry, and I'm just going to call him Barry to introduce himself, and we'll just go into sharing the story. Barry, are you okay to speak today? Are you fine?
Yes, yeah, thank you.
Okay, go ahead when you're ready.
Well, first off, my name is Barry. I'm 54 today.
Happy birthday.
Thank you. I was diagnosed with a colloid cyst back in June, September 29th. And I just had my surgery like 3 weeks ago. And so far, so good.
Thank you. Thank you. So we have a few questions that we want to ask you so you can talk on that so the listeners can understand. And for those who probably going through the same thing and don't have any resources, I'm sure that's what you told us before, that you couldn't find any material and you want to do this so people can understand this diagnosis better. So how did you find out about the tumor?
Well, I found out about the tumor because I had a lot of recurring sinus infections this past winter, and I would just go to the clinic. They would give me antibiotics. The antibiotics would work to kill the infection, and then like a week or so later, they would come back. And my wife told me I had to stop going to the clinic and actually find out what was wrong, why I kept getting sinus infections. So I wound up going to ear, nose, and throat, who she tried to scope my nose. And because of a previous injury when I was a kid, my septum is deviated. So it's offset to the right by about a quarter of an inch. And she couldn't get the scope up my nose. So she told me she was going to have to break it and move my septum over. When she got up this side, she saw some polyps up there, which is mostly what's getting infected up there are the polyps. And the infection hides up inside the folds of the polyps where they go around the membrane of the sinus cavity. So she said she was going to have to break my nose and move it over so that she could go up and get the polyps out. But in order to do that, she wanted to see what was going on in there. So she ordered me for a CT scan, which when I took the CT scan, they saw the mass back there. And originally it looked like it was on the pituitary gland. But ultimately it turned out that it wasn't. So that's how we found out, was by pure luck.
Okay. Oh wow. So upon finding out, what you do? You did a CT scan. They send you to get some CT scan done to find out, and that's how you found that you had the colloid cyst.
Yes.
So what were your reaction and your feeling when you got the call of what was found?
Well, the ear, nose, and throat doctor called me very early in the morning. I actually had just gotten to work when she called. And she was very, she seemed like she was very worried, which when you're dealing with a medical professional, she was very adamant that I needed to go see a neurologist. I needed to see a neurosurgeon. I needed to have an MRI. Couldn't put it off. Had to get done. It was very important. And I kept asking her, is it cancer? And they can't tell you. They don't know.
Wow.
They didn't know at that point what it was. And like I said, originally they thought that it was on my pituitary gland. I guess with the CT scan, they can't really get a good 3D picture of it, so they don't know. They just see that it looked like it was right by my pituitary gland.
Okay.
Um, and so then after the doctor and I hung up, I started sort of Googling a bunch of stuff,
Mm-hmm.
and I wound up Googling myself into absolute being petrified, thinking that I had uh, brain cancer.
Wow.
And when you're got two small children,
Mm-hmm.
that's you don't want to. It's not time to check out yet.
Yeah.
Um, so yeah, that's the. I was scared, and I was looking for um, some kind of answers, and I couldn't really find anything.
Mm-hmm.
Like people that had gone through what I'm going through um, online. Like if I wanted to find the operation, I could go on YouTube and watch the procedure being done, but I
Okay.
couldn't really find anybody talking about their experience. Um, so I could kind of see what I had to look forward to.
Mm-hmm.
Uh, and it was all very mysterious, and like I said, it was scary, uh, very scary.
What I want to ask though, where were you up to the time in your mind process up to leading to the surgery and all the different things that you have to do, like the MRI, the constant visits? Where were you like spiritually, like in your head? Because sometimes, especially with things like these, you never know what somebody's going through, because at the end of the day, for something like this where you have no information on, how you go daily knowing that you just got this news and you might be dealing with something that nobody basically had gone through.
Well, up until when I finally saw the doctor,
Mhm.
I was very scared. And then once I saw the doctor, he put my fears to rest.
Mhm.
Um, when he told me that it wasn't cancer after my MRI,
Mhm.
he told me that it was 99% chances, probably benign.
Mhm.
And with that, I relaxed a bit.
Mhm.
But then when they said that I was going to have brain surgery, that was another thing that that's scary. They're all the way in the middle of your brain. It's a scary thing. It's not something that it's not like getting a mole removed.